Good evening. The program is Sound Health on Lagos Television. Thanks for always finding time to join us. I am Olasumbo Modupe. Last week, Dr. Wina Olatemiju shared her expertise on ulcer and how to prevent and manage it. This week, we bring you the concluding part. Please stay tuned.
What if we could design an economy that would prioritize the health of all people and the planet we live on? Where a successful economy is measured based on every person's contributions to society, and health is seen not as an additional cost or potential budget cut, but as a necessary investment for our future. A world in which health innovations are shared for the common good so that everyone can access the healthcare they need wherever they live in the world. And where governments have the capacity and resources to drive these changes. This is the vision of the W.H.O. Council on the Economics of Health for All. The Council makes 13 bold recommendations informed by evidence and case studies from around the world. These recommendations should serve as a compass to guide us all towards a world in which people, planet, and the economy are aligned. Because the question is not why should we, but what's holding us back.
Can this condition affect any age, or is it just a particular age bracket?
And ulcer can affect any age. Yes, ulcer can affect any age. Come across board, irrespective of that culture, background, and age. It can affect any age. Infants also have ulcer. Infants, they have it. So the only thing that the parents have to know is that this child might not be gaining weight. It's not eating properly. This child is always occupying abdominal pain. Pain, mommy, pain. And then some parents might not have that foresight as why is this child always complaining of pain in the tummy, pain in the tummy. So anybody can come down with ulcer. There's the only immune against ulcer, number one is good hygiene. Balanced diet, boost your immunity, fruits and veg, good hydration, take water, reduce soda intake, dietary review, lifestyle modification, and good exercise.
You said it can affect infant. Does this mean it is hereditary?
Yeah, ulcer is there's genetic disposition of ulcer. There's genetic risk factor, but it's not so much. It's about 5%. So it's possible that somebody, it runs in some family that they always have ulcer. But even with this, there must be other adjuvant factors, there must be risk factors that will, loud the symptoms in the person. One, most likely the individual might not know that this thing is in my gene. And then, how am I going to help myself? The individual lifestyle might ask precipitate it faster. It's not eating, it's not the eating type, it's the junk type, it's the spicy food type. These are what precipitate is. He loves spicy food. And some people take alcohol, some people love coffee. These are risk factors to what is called peptic ulcer. So if it's even running in the family that is genetically predisposed, if the individual is aware and takes precaution, the person might not come down with ulcer.
How do you prevent this condition apart from eating well and eating at the right time?
Preventive measure for ulcer. The preventive measure is majorly good hygiene, like in case of this H. pylori that I've just explained to you, which is common. It's common because a lot of people, about 60% of people, they eat outside. And we are questioning the hygienic level of these our food handlers. Because the truth of this, water is now expensive. So, and they have to use water. They share spoons in restaurants, and these are supposed not to be, because some people will just get to the restaurant, they get it, and then they share these cutlery. Though they have washed it, they send it to another person. What if the person that has taken it before is an ulcer patient and has this H. pylori? The person does not know, so you don't share brush, you don't share some things with people that are having this ulcer issue. You have to be very, very, intentional when you want to prevent some things. You have to also know that this thing is, number one, a meal build. You must build your immunity. So you eat at the right time, eat good food, know what to eat, don't just eat anyhow. Reduce spicy food, because spicy food can cause, when we talk about acid medium of the stomach, when you eat too spicy food, you are exposed to this ulcer too. Healthy spicy is not the best. Stop alcohol if possible, stop caffeine if possible. Drink more water. More water. Take fruit and veg. And take fruit and veg, wash them very well before you eat them. Wash them. If you are eating your own homemade food, you will wash your vegetable very well. Twice to make sure that everything is okay. But what you are eating outside is a bulk, production, and then they can just wash it once, and that's all. And it's not thorough enough. And that is part of what we have to do.
Okay.
And also, an individual should be aware that ulcer can affect anybody. Your lifestyle can also be a predisposing factor to it. So take care of yourself. Self-care is not selfish.
Okay, Dr. Olatemiju, tell us, if left untreated, could there be complications?
If ulcer in any part of the body is not treated, it can be complicated. Now, if like leg ulcer is not treated and is there, it will keep expanding, superimpose infection. Eventually, this can lead to amputation of the leg. Venous ulcer can lead to the deadness of that area of the body. And it can lead to this pressure ulcer, can lead to overwhelming infection, because there's breakdown of immune system and there's availability of spot area where this microbacteria can penetrate and infect the whole body. You have overwhelming septicemia in the body from head to toe. And if it's peptic ulcer, if not treated, it can lead to perforated ulcer, which will require both surgical intervention and dietary review. So in that case, when you are not treating the ulcer, the complications are there enormously, and it's better prevented than treated, because the person will not like it.
Are there any food people with ulcer can, eat? Because oftentimes we hear people say, I have ulcer, I cannot take beans, I cannot take a particular meal. Are there specific food or diet persons living with ulcer can be placed on or eat?
Ulcer people are, beans particularly is not anti-ulcer. I explain now, this is what happened. I just explained to you that H. pylori is a bacterium, and it finds a way to encapsulate, like to protect himself against the acidic medium of the stomach. Now, what this organism do is that he will convert urate in the stomach to urea and carbon dioxide, and just not protect himself in that region, and that's why it got penetrated into the mucosa. Beans also have ammonia, but the beans that have this gas is not the one that can help. It doesn't aid this organism, but the medium, the alkaline medium produced by beans and gaseous effluent from these beans does not enhance this organism, but excessive gas can cause more discomfort to somebody that has ulcer. So it's not as if it's anti-ulcer food, no. If somebody wants to eat beans, pick the beans. You can also make sure that you soak it just because of the gas and because it takes time for beans to digest. So it's also going to increase acidic production of the stomach that can cause discomfort and then it can cause this bloating. So that's why beans is beans. Some people are trying to avoid beans, but it's not anti-ulcer, whatever. If you don't eat beans, you can peel it, soak it, and then eat portion control to help you digest it. Other food that you can take is some fruits, they are good. Avocado is good. For us, that is good, is a good fast. Take it, wash it very well, and take it. You can take, even if you have ulcer, you can take this yogurt that has a living culture. It's not the processed one, it's the yogurt that has the living culture. Then you can also take less spicy fruits and foods, reduce junks. Then if you are the one that takes smoking, stop caffeine, stop alcohol, take more water for easy digestion and for the dilution of this acid. Take more water. It helps in healing. It also helps in good hydration of the whole system. So it's good. Veg and food is good. Homemade food is advisable. Less spicy food is also another good dietary review that you can do.
All right.
Basically, there's no food that is partly anti-ulcer. It's just you have to know what portion to take and when to take it. And lest I forget, you should also try to avoid painkillers. People take painkillers a whole lot. Some people come back from work, they get tired, they take painkillers. And they have access to it. It can also lead to this ulcer. So you avoid it. Rather than this painkiller, why don't you try to get adequate rest? And when you rest very well, it's a good stress management. You will be calm and you'll be cool. If not properly treated, it can come back. Ulcer can be reinfected. So the reinfection is there. So that's why anybody that has ulcer cannot treat him or herself. The fact that they have access to pharmacy in Nigeria or to have access to drugs does not give them that. There's no leverage on that to go and be buying drugs and go to the pharmacy. Oh, I have ulcer, and they will give you ulcer kits. No, forget about that. See your doctor. They will evaluate you very well and they will give you the right dose of drug. It can linger from weeks to months when it comes to peptic ulcer. So you need your physician all through the way.
All right, Dr. Olatemiju, your final words. Do you have your parting shots or remarks for members of the public?
Thank you so much. My parting word for everyone hearing me is ulcer can be treated, ulcer can be reinfected, ulcer can be complicated. But the golden rule to this thing, apart from about 5% that is inherent, that genetically risk factor, you can prevent most of this ulcer. It's preventable. Your lifestyle modification, dietary review, good hygiene, sleep well, good quality sleep will help you to calm your system down. Let us always see our doctor when we have any complaining. Is the ultimate, and we will not be seen. Also remember that your health is important. Your health is your wealth. Take care of your health so I can take you on.
All right, Dr. Olatemiju, your health is your wealth. Take care of yourself. Embrace a healthy lifestyle. Dr. Wina Olatemiju, general healthcare practitioner and mental health advocate. Thank you so much for your time and expertise on how to manage ulcer.
Thank you so much. You're welcome. My pleasure.
All right, Sound Health continues with trending health report from around the world. Please stay tuned. You are what you eat and not what you wear. Eat balanced diet and boost your immunity. Avoid self-medication. Reach out to the nearest healthcare practitioner if you feel unwell. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #SoundHealth. A sound health is a sound mind. Make healthy living your choice.